Good morning, and we're glad you could join us for today's webinar presented by the Alliance regarding how your business could be affected after the 2024 elections. We're going to talk about some post-election health policy, and as you as self-funded employers or the advisors to those self-funded employers, what you need to know regarding the changing landscape due to come up here after the elections this fall. As we were thinking about an image that would capture the spirit of this conversation today, this stretch of Highway 42 heading up through Door County as you approach the Washington Island Ferry, we thought was appropriate. There are 15 serpentine curves that finish that stretch of highway. And those of you that have traveled that know that if you're not paying attention and don't have a good navigator, that could be a bit of a treacherous stretch. So we want to make sure that visually we are creating this environment for us today in today's discussion where we're navigating the legislation that's due to come up after the elections and making sure that you know that you've got some tools to help you navigate the legislative landscape similar to the way that we would navigate that stretch of highway approaching the ferry and then that trip over to Washington Island for those of you that are familiar with that. A quick introduction here of me. I'm going to be the host for today's discussion, also moderating our panel. I'm Kurt Kubiak, the President and CEO of the Alliance. I'm glad to be with you all today. Definitely embrace and embody the spirit of the Alliance, making sure that we've got access to affordable health care and that all of our employers feel well prepared to be able to manage their benefit plan design on behalf of their employees. So welcome to the discussion. I'm glad to be with you. For those of you that are familiar with us at the Alliance and those of you that are getting to know us, as I stated, we are definitely advocates for the employers in ways that they can purchase healthcare more easily, more affordably, and with high quality providers. And so that means some things that are tactical with regard to our PPO network, as well as our preferred value provider network. But it also means that we need to be paying attention legislatively to what's going on in the state and also at the national level in advising our employer members and their advisors of what we see coming down the pipe. And so we're going to talk about those things today in our panel discussion, and it's very congruent and complementary to the work that we do each and every day. Before we get started with our discussion, just a little bit of housekeeping. Note that everybody is going to be muted, but we certainly do want to hear from you, our audience, and please feel free to give us your questions using that chat feature. You feel free to give us feedback using the emoji buttons that you'll see at the bottom of your screen. And feel free to ask for any technical support that you might need if things aren't functioning exactly the way you need them to in order to receive the message. Some tactical items for those of you that are looking for credits. Make sure that you use the resource button there, that little paperclip icon. From there, you can get the SHRM credits that you're looking for, the CE button at the end of the presentation for that CE code, and for the HRCI credit, please email us at events@thealliance.com. That's EDENTS at thealliance.com. And a note here that credit for participation in this event will only be for those that watch us live. We are going to be taping this and it will be available on demand, but unfortunately, if you watch us on demand, you will not be eligible for those CE credits. So please stay with us and stay tuned for the live event so that you can earn those credits. And then, as I said, this will be available on demand, both on our website as well as on our YouTube channel. And for those of you that have registered with us, everyone that has registered with us will receive that email message letting you know when those when the video is available. So looking forward to getting started with today's discussion, having given you the details of how the day will work. I also want to make sure that I take the time and recognize our sponsors, Delta Dental and the National Cooperative RX. Without these individual groups supporting us, we couldn't bring these educational opportunities like this webinar to you. So I encourage everybody listening to please patronize those vendors and include them at least in discussions about your benefit plans as you consider your options into the new calendar year. And with that, I'd like to introduce you rather to our panelists today. And so we are fortunate enough to have some distinguished panelists with expertise in a number of different areas. And I'll start out with Josh Bindle, the CEO of National Cooperative RX. Josh has worked with the self-insured community in plans of different sizes and types over the past 20 years. He's previously overseen a self-insured group of local governments with the Wisconsin Counties Association. And today, as CEO of National Cooperative RX, Josh promotes higher value care and pharmacy benefits, representing over 300 employers, unions, and coalitions, which collectively are responsible for the health and well-being of 480,000 participants nationwide. So welcome, Josh, to the discussion. Next up, we've got Melissa Duffy, who is the owner of Duffy Communication Strategies. And Melissa works to leverage her extensive experience to help healthcare purchasing cooperatives, such as the Alliance, improve the cost and quality of healthcare across the country. She was formerly a lead advisor to the Wisconsin State Senate on health policy, where she helped pass laws and smooth the regulatory path for common sense and pro-consumer changes to the healthcare system. After leaving the Senate, Melissa worked in the private sector, developing and promoting healthcare purchasing cooperatives as a model for consumer support and empowerment. She specializes in government relations, public relations, media, healthcare advocacy, and cooperatives. So please help me in welcoming Melissa to our panel. And then finally, I'd like to introduce you to Rachel Rivelli. Rachel has worked over the past 12 years in health policy, working with the U.S. House of Representatives and the Wisconsin Legislature. She is the Associate Vice President of Government Relations and Senior Political Advisor for the Wisconsin Manufacture and Commerce Group, known as WMC. In her role, Rachel represents the business community before the Wisconsin Legislature and state agencies. She advocates to allow patients and employers to access transparent health care and to prevent health insurance mandates that increase the cost of health care. So please join me in welcoming Rachel to the discussion. So a little overview of the agenda for today. We are certainly going to talk about what's top of mind for all of us, about 40 days away from our election. The federal election at the presidential level, we'll talk a little bit about what the implications are there. In addition to that, we know we've got some highly contested congressional races that will have an impact on the legislative scene, as well as the state elections. And we know that the state elections where we could be more actively involved as employers, that take an interest in specific opportunities to manage the legislation that affects us throughout the course of the year. So those would be the areas that we tend to talk about. You can see our three panelists with us now live. Thank you for joining us. And Melissa, let's start with you. If you could please help me understand what's happening at the federal and state levels regarding the elections coming up here this fall.
Sure. Well, there's been a lot of talk about the differences between the candidates on healthcare issues, but much of that is specific to the Affordable Care Act, which Harris supports and Trump wants to replace. But when you drill down to the primary issues impacting employer health benefits today, the differences are not so apparent. We know it was the Trump administration that first put price transparency regulations in place, but it was the Biden administration that moved us forward. And both candidates have made supportive statements about increasing healthcare price transparency generally. Trump signed the No Surprises Act into law, but it was the Biden administration that implemented it, and it's been a bipartisan effort around mental health security protections. I'm sad to say neither candidate has released a comprehensive plan to reduce costs. So what I see as the biggest difference between the two will come down to their priorities. where President Harris is likely to put more emphasis on enhancing the ACA and government programs like Medicare and Medicaid, while President Trump will put more emphasis on private sector solutions.
Excellent. I appreciate the perspective. And now, Josh, on to, how do you think the national election might impact us specific to the way we buy pharmaceuticals going forward?
Yeah, thanks, Kurt. So at the federal level, I mean, we're in this great political divide. There's division between the parties. They're trying to stake out territory, what they represent. But honestly, in prescription drugs, I don't think you're going to see a whole lot of difference between the two candidates. Looking at, presidential election, they're both going to have this, anti-pharma, message. We need to lower costs. Costs are too high. They might fight a little bit over who is responsible for the changes in insulin. They're both for prescription drug importation, very complex issue. I think former President Trump maybe would push that issue a little bit more. But if you look at, if he were to be reelected, the Biden administration put in the Inflation Reduction Act, which forced negotiations with Medicare and Medicaid on drug prices. I don't expect that he would undo any of that. So I don't think the elections are going to impact a lot. And quite honestly, at the federal level, there's a lot of stuff going on. I won't dive into details on it, but there's PBM reform legislation that is likely to be passed in a lame duck session. I probably wouldn't have said that a year ago because there's so many different bills and there's a lot of talk, but there is a lot of talk that will get passed in the lame duck. A lot of transparency, disclosure, information that plans will get as a result of that passing. There's two different efforts to revise patent protections and get rid of something called junk patents or patent thickets. So AbbVie, the maker of Humira should have been open to competition many, many years ago, but they filed like 250 patents protecting it. So it had like a 20-year patent life instead of about 12. So there's reforms underway to fix that. And then the Federal Trade Commission is investigating PBM. So there's a lot of things that I think will just continue no matter who's elected, which is kind of interesting at the federal level.
Yeah, Josh, I appreciate the high-level overview of what could happen and the two candidates' different perspectives. Is there anything that we ought to be considering at the employer level specific to pharmacy benefit management or pharmaceuticals?
At the federal level, I don't think so. I mean, I think in watching what comes down, it's really hard to impact legislation at the federal level. It is a big money game, but as employers, being engaged just to understand what's going on, because some of the transparency legislation that has been passed results in things that plans have to do. So you do have to keep up with that stuff. It's been one of the consequences of the transparency buzzword. It has put more work on employers. So there are things that you have to do, but are you going to be able to change that as an employer? Maybe as part of a big association nationally with some money behind it, but not as an individual employer.
I appreciate that too. And again, paying attention and being engaged is probably the first step for all of our listeners, just to make certain that they're not only aware of what's happening legislatively, but that they're also part of the conversation. So thanks for that advice, Josh. Appreciate that. Rachel, can you talk about what's happening at the congressional level and how that might impact employers post-re-election?
Yeah, we have some interesting dynamics at the congressional level. So currently, the majority in the Senate is held by Democrats. The majority in the House is held by Republicans. We're going to see change this election on that. It is pretty much guaranteed, unless something crazy happens, that the Senate majority will switch over to Republican majority. And then in the House, it's really a toss-up right now of whether it's going to be a Democrat majority or a Republican majority. But as many of you probably have seen, there's a lot of dynamics within that Republican conference where there's some factions that are really making it really difficult for them to govern. We've seen that in the funding fights, and we know that those, a lot of people would call them far right, and you could argue maybe populists, are kind of holding up some of the things that leadership wants to advance. So even if Republicans hold that majority, it's going to be really difficult for them to get things across the finish line. But there is some similar problems on the Democrat side too. They do have some factions of those, further left or, even progressives that are stopping their leadership from able to get some of their things across the finish line too. So I think this election, it's really a toss up on what that makeup is going to be. But there is legislation within at the congressional level that has been really important for employers and consumers alike. And that is the Lower Cost, More Transparency Act. And it's a really important legislation because, as Melissa mentioned, under Trump and continued under Biden, there were those hospital price transparency laws put into place. And those were regulations, though, and those could go away if a president decided that they no longer wanted those regulations. So this bill would put those regulations into law. It changes, a little bit what they did, but for the most part, it's taking those hospital price transparencies and putting them into law. There's a couple differences, though, that it does. The bills, there's one in the House and in the Senate that they do add labs and imaging centers and ambulatory surgery centers into those transparency law. But then also it gets rid of the price estimator tools, which are really problematic, not only for employers, but also for consumers who are really trying to shop around and get those prices. And there's been some issues with those price estimator tools. But one really important thing that is within the Senate draft of the bill is that it provides employers the ability to access their data. And so that's a great provision within that Senate version that is not in the House version. The House version did pass through the entire House. It's an overwhelming vote, 320 people, legislators voted for that bill. So high bipartisan support. Unfortunately, we haven't seen the same movement in the Senate. So that's something that we're really hopeful that next session would move forward. And I think there's a possibility of that because it is bipartisan and it is something that, really both sides are in agreement on.
Yeah, I appreciate that, Rachel. And it is interesting because both the Senate and the House are very tight with regard to the difference in terms of the two major parties, that we may see some more bipartisan support for bills going forward, which we haven't seen in quite some time. Do you speak about that just for a moment?
That is definitely true. My former boss served on the Education and Workforce Committee, and so I got to see some of the healthcare legislation that moved through that committee when I worked for him. And there is a lot of times, people don't realize this, they think that everything is super partisan in Congress, but there's a lot that's actually worked on a bipartisan basis. And when both sides agree on an issue, and one of those issues is healthcare price transparency, they're really, really willing to come to the table and work together to get things across the finish line. And that's why you saw the House have that overwhelming vote on this legislation. And I think we'll probably see, some of that happen next session as well, just with those slim majorities that we'll be seeing in both houses.
Excellent. Yeah, I appreciate that. So again, regardless of which candidate, which party ultimately holds the majority and which candidates ultimately reside within our state and represent us, it is important that as employers, we are actively involved in speaking with them about our interests so that they can represent us at that federal level. And I think it's important to understand that there's a good chance that we could have some bipartisan support. So again, another reason to stay close to the legislative issues, the topics, and then also be close to your representative to make sure your interests are being represented. So thank you, Rachel. I appreciate that. Now getting down to the state level, Josh, we'll start with you on this series of questions. So what's happening at the state level with regard to PBM or pharmacy benefit management reform? Particularly, we've got a drug coupon bill and a mail order bill. Can you speak on those topics?
Yeah. So at the state level, this is really where I think employers can have a great impact, and WMC and the Alliance are proof in their involvement in prior proposals where they got employers to engage, and really that is what legislators want to hear from employers, want to hear from people in their district, and they're hearing from patients and the patient side of it. A lot of bills are being proposed across the country. I think, last count's over 800 bills have been proposed over the last few years. 150 have been passed, at least one in every single state. And it's all under the idea of PBM reform. PBM are middlemen, they're bad actors. It's independent pharmacies and pharmaceutical companies that are proposing these. And yes, they're getting patients involved and telling a story that is really easy to tell. You might say, well, PBM reform, that's good. PBM licensure, PBM registration, certain proposals maybe on how a PBM can audit a pharmacy, I think as employers, that's totally fine. The problem is that a lot of these bills limit an employer or plan sponsor's ability to design the plan in such a way that drives lower cost, higher value care, and really just drives up costs for employers. So a few of the provisions that have been proposed, again, there's a lot of commonality across the country, but there are certain little nuances in each state that one state might leave something out, add something else, but generally they're restricting mail order. You can't steer your participants to the mail order pharmacy. You can't actually share savings with the plan participant if it is a lower cost pharmacy and your plan is trying to drive patients there. You can't share the savings. They're taking that incentive out. You can't drive patients to an exclusive specialty network. So these are the very high cost medications taken by about 1% of your population. You can't steer them there in a lot of these proposals. The very telling provision that has become more common is they're mandating certain reimbursement fees for the pharmacies. Independent pharmacies, national chains, none of them are doing overly well right now. And they're trying to increase how much they get paid. Well, where's that money come from? It's not like the PBM finds a hidden pot of money that they're like, oh, we'll just take it out of here. They take it out of the plan. So they charge the plan more under these situations. And then, Kurt, I think you mentioned, kind of the copay bill, and I will dive into this one a little bit more. This is a widely misunderstood provision, misunderstood by employers, but especially by state legislators. This is the dynamic where pharmaceutical companies will provide coupons for patients. And again, they're providing the coupons to patients by increasing the cost of their medication, the cost that plans are paying 90% of. Coupons are not even allowed in Medicare, Medicaid because they are known to drive up costs. They are known to drive waste in plans. We're not asking for coupons to be banned, but PBMs have created basically programs that say, okay, if a patient used the coupon, well, that didn't come out of their pocket. That came out of a pharmaceutical, dynamic. The company provided that. So they shouldn't get credit towards their out-of-pocket maximums, towards their deductibles. So we're going to fix that. We're going to make it clear that, that coupon that was used was not their money, and they shouldn't then accumulate towards their out-of-pocket maximums. Some of these drugs are very high cost. Individuals could actually use a coupon and totally fulfill their out-of-pocket maximums. Not have to pay anything themselves, just coupon value accumulating to that out-of-pocket max. To me, this is a fairness issue. So I've used the example, there's not a knee replacement coupon that somebody gets to use at the hospital when they get their knee replaced. So why does that person have to fulfill their out-of-pocket maximum when somebody on a very high cost medication is using a coupon and they don't have to pay anything out of pocket? So that is another provision that as PBMs have created that program, pharmaceutical companies especially are trying to get that outlawed. Last count I had was 19 states that banned that practice of using an accumulator program.
Yeah, interesting how your perspective on how you take these national and state level legislative issues, when you translate those into benefit plan design at the employer level, how without understanding those details and the way that those changes would impact that benefit plan design, you really don't know at the surface whether or not to support these things, right? What intuitively seems like a very easy decision is far more complex. Is that what I'm understanding?
Yeah, well, and to relate that to legislators and employer groups, I mean, the issue is that when these proposals come out, they sound like, the magic bullet, we're fixing everything. And so many legislators sign on. And then the minute it gets explained to them, they're like, oh, wait, that's not what I thought it did. I guess I didn't understand the full picture. And then if you get employers involved, then they start jumping off the bill in a lot of situations. They're like, I don't want to be associated with this anymore. I'm not going to vote for this. Now that hasn't happened in every state. That's why a lot of these bills have passed. In Wisconsin, they've been watered down. The plan design provisions that would impact costs have been taken out, and then smaller provisions have prevailed. But this 100% is coming back in the state of Wisconsin next session. There will be a robust bill trying to do what they've been trying to do for over 5 years.
Yeah.
Kurt, I'll just jump in here real
Yeah, please, Rachel.
Quick and mention, I'll just mention, kind of expand on what Josh said there. I think a lot of legislators struggle to come up with a solution on healthcare. And so when these groups come around and tell them that they have the solution, they just immediately sign on or even agree to author the bill, because they can go back. I mean, you have to think about that legislators look at policy as a part of politics. And so they think that they can use this bill to message in their next campaign and reach out to their constituents. It sounds good. So it's something that they can utilize in the next election cycle. And so we fight that battle. But I agree. I mean, the copay accumulator provision was within the PBM bill this session, but it also was a separate bill. And I think we're going to see it both ways again this session. And there's going to be a hard push to get the PBM bill across the finish line. But I also think that this, in particularly the senator who is the author of the copay accumulator bill, this is a passion for him, and he is going to continue pushing for it as well.
And Kurt, if I could just add one thing, Josh talked about the importance of staying informed. I just want to remind attendees that we have a handout available for download that kind of goes into more detail on these issues.
Yeah, excellent point, Melissa. And that, again, it's a nice summary. It gives you a high-level understanding of what each of these bills contains, and then how that would impact us as employers. So yeah, give that a look. It's a quick read, and thank you for making mention of that. I believe that there is an opportunity for us to educate ourselves and educate our legislators to make positive change, particularly at the state level. Melissa, Rachel, you were part of that organization with regard to the white bagging bill that recently took place here this year. Can you talk a little bit about that, Melissa? What happened? And Rachel, if you would mind commenting after that first response, I'd appreciate that.
I can start. This was a bill that out of the gate had a considerable number of legislators signing on. Again, as Josh mentioned, that happens often when we don't have a chance to educate lawmakers before these bills come out. In fact, on this bill, we had almost 2/3 of the legislature that had signed on as co-author. It didn't move forward because employers stepped up on the issue and made their voices heard. We were able to go to the Capitol with employers, explained how the bill would have made healthcare more costly, and we were able to convince a sufficient number of lawmakers that it wasn't a good idea to move the bill forward. And Rachel, maybe you want to explain the bill and talk about the cost implications a little bit.
Yeah, absolutely. I'm happy to do that. So the bill itself was a bill to prohibit white bagging, which is a practice of having a specialty pharmacy ship a patient's clinician-administered medicine directly to the provider to administer. And so we saw this bill introduced, not this last session, but the session before. And like Melissa said, employers really stepped up because this is a cost-saving tool for them. It really is one of the tools that they have in the toolbox to contain costs. And we had employers that came and testified and talked about what those cost savings were for them. One of our members and one of the Advancing Free Market Healthcare members came and testified and said that in 1 year, they saved $175,000 just by implementing white bagging. And the reason that there is such a huge cost savings is because when it's pulled off the shelf and billed by a hospital, there's a pretty significant cost increase. In fact, they're marking up the drug almost over 200%. In fact, the there's 1 in 10 hospitals marking up the drugs 900% or more. And there's even research that shows there was about 320 hospitals throughout the country marking up these prescriptions 1,000%. So these numbers that employers can save by implementing this are real dollars because of those markups. And we really, we faced difficultness because there was, a lobby of folks lobbying for this bill, but it was really the employers that stopped that momentum that was going. And, there was a memo that was circulated that had over 100 employers that signed on to it saying that this would really affect them. And I have had, the author of this bill told me that he's looking at introducing it again this session. So I think we can expect that to happen. But he did tell me that if you ever want advice on how to kill a bill, he's like, do that again. Have a memo sent around that has 100 employers with all their logos on it. And so I think that provides opportunity for us and for our employers that if you step up and make your voices heard, that legislators will take notice.
Yeah, thank you both, Melissa, for the overview, Rachel, for the details on exactly what was going on there and how we as employers came together and had made a difference with the legislator. And again, I know that all of us are busy. We've got a lot going on in our days, but there will be times when we're going to ask you to sign on to letters like the one that Rachel just described, or attend a meeting, or talk to your legislator. And in conversations that I've had with legislators, they tell me that they very rarely are invited to talk to the employers. They like to visit the employer sites, understand the business, understand how the decisions that they're making may impact that employer, particularly as it relates to the healthcare issues that we're speaking about. So I'm glad to hear you all talk about the ways that we have already positively impacted some state legislation based on participation from employers. I'm just going to ask again the folks that are listening to today's webcast to please pay attention to your inbox. Please pay attention to conversations that you're having around the water cooler or with your colleagues. When the legislative issues like those that are noted in our handout come up, it's important that we're educated. It's important that we take action, that we sign on to these bills, not just to be aware, but to actually do something. And so I appreciate the perspective of each of you on that topic. Getting on to a next question, state level, Melissa, what are we looking at for other issues that may impact employers and their ability to have flexibility in their plan designs?
Sure. Well, first I'd like to talk about a proposal that has been referred to as the prompt pay bill, although the title is questionable. Currently, there's a section of the Wisconsin statutes that prohibits healthcare providers from reducing or eliminating copays, co-insurance, deductibles, and certain provider organizations are saying this section of the statute needs to be repealed because it prevents them from offering discounts to patients for paying promptly. But last session's bill didn't mention the word prompt, and it didn't put any guardrails around discounts. So instead, it would have opened a loophole wide enough to drive a tanker truck through. Now, how this impacts employers, many of our employers have implemented high-value plan designs, which are saving employers and employees money. But those aren't going to work if deductibles and copays can be undermined. And I'd also mention that we're likely to see a proposal this session to limit prior authorization. We don't know the details of this bill yet, but those of you that use prior authorization in your plan designs will want to be paying attention to that issue.
Again, Melissa, here's another example of something that sounds pretty benign in its title, right? A prompt pay bill that can have some pretty significant impact on us if we don't understand what's in the bill and understand the potential impact on our benefit system. Thank you.
Right.
Rachel, I'm going to give you another opportunity to speak on a question that's come up recently and with some fervor, which is healthcare price transparency. So we know that there's federal law relative to healthcare price transparency, and also now some legislation that's coming out at the state level. Could you explain what the state level legislation is, how it relates to the federal level, and what the implications might be for our listeners?
I'm happy to walk through that bill. And I think this is a bill that unfortunately did not get across the finish line this session. But But the author of the bill, Senator Falskowski, is incredibly passionate about this bill, and it will be back this session. I think there's going to be an even bigger push for it this session than last session. The bill itself would somewhat mirror those federal regulations. It would require a machine-readable file, and then also 300 shoppable services. Now, would not allow a price estimator tool. It would require those 300 shoppable services to be posted. And the reason that the senator and the Alliance and Advancing Free Market Healthcare and WMC supported the legislation is because we really feel that it's important to put this law at the state level, because the state has a better handle of our healthcare system here in Wisconsin. Unfortunately, CMS is completely overloaded with all of the different things that they do, and they have just not had the time to look and see if people are actually in compliance. So if we put this at Department of Health Services here in Wisconsin, we feel that there could be better oversight. The whole goal of this legislation is to make sure that hospitals are in compliance. It is not to attack hospitals or, to levy fines on them, but rather just to make sure everyone's in compliance, because that's what's best for both employers and for consumers, because they will be better able to shop around and be better consumers of healthcare. Unfortunately, last session, the bill had a hearing but didn't move any further than that. We went through some discussion with the speaker. The speaker became very interested in this bill towards the end of session and brought employers and hospitals and some in the insurance industry into the same room and asked us to have a conversation about how we could get to similar goals. We had that discussion a couple different times, and I think everyone was kind of on different sides. I think employers are really willing to talk about how we could get there, and I think hospitals realized that we were towards the end of session, and if they just kind of ran the table, this bill wouldn't be implemented this year. So it didn't happen. And quite honestly, the speaker said that it's something that he wants to look at again next session. He wants to continue talking with us. So it's a great opportunity for employers to come and talk to their legislators. I think a lot of legislators don't understand how this affects employers. They can't draw the dots together. They can't connect those dots and see why employers care about healthcare transparency. I think it's so common sense to us, but so many in the legislature do not have a business background. So they have never had to handle their own healthcare before. For many of them, in fact, they've been public servants a lot of their life, and they've had pretty great benefits, and they haven't had to shop around. And so I think that employers stepping up and going and talking to the legislators and talking about why price transparency is so important to them, but really not only to them, but also to their employees and how you will utilize that price transparency, that's a really important step that employers could take. And you can start even doing that now, because we know that this bill is going to be coming up this session. So start educating now and continue educating employers on what transparency means for you.
Yeah, thank you, Rachel. I appreciate the response. And I think it's important to note that what we're advocating for is access to the data which we would need to solve a problem. And that, again, to reiterate what you said, not trying to be onerous on any particular actor in the entire value chain, but rather trying to understand how it is we can work as partners in addressing the issue, which of course is the cost of healthcare and trying to manage that. And so with the data, that would allow us that opportunity. So I appreciate you making mention of how this is so important to us here. Melissa, if we get down again at the state level, are there things that employers can do locally to help them get involved and get engaged? I know you're leading an organization that might be able to help them out.
Sure. Well, I can't emphasize how important this is. Josh mentioned that legislators really want to hear directly from employers, and that's so important. Rachel, Josh, and I will continue to be in the Capitol working together on these issues, but we need employers to be reinforcing these important messages. Rachel talked about price transparency, and this is a perfect example of how effective we can be. Last session, we had a group of employers that came to the Capitol to meet with legislative leaders to share thoughts and ideas. And that's really what led to employers being at the table for price transparency, which is great progress for us. The same group of employers that came to the Capitol recognized the need to sustain this kind of outreach So they created an employer-led advocacy organization called Advancing Free Market Healthcare. Its mission is to amplify the voice of employers when it comes to health policy, mainly at the state level where they have the best opportunity to influence outcomes.
Excellent. And again, I think for our listeners to understand that there are a variety of ways that they can become involved and take action, and advancing free market healthcare is just another one of those options. And so if you look into that as an employer or as an advisor to an employer and you believe that that's a solution that you're interested in, certainly want to make sure that the group is aware that that is an organization that is out there to advocate on behalf of employers. And can they get a hold of you, Melissa, directly? How do they, I wanted to get involved, how do I do that?
Yeah, now that advancing free market healthcare is out of the starting blocks, the important next step is to grow the organization to make our voice stronger. So if you're interested in becoming a member, please go to advancingfreemarkethealthcare.com to learn more and sign up. All you have to do to be a member is volunteer to do one thing that will help us advance our mission forward. For example, we talked about the importance of logos being on letters. That could be one thing. And Advancing Free Market Healthcare has been organizing regional meetings that bring together employers and lawmakers for discussions. So attending one of these with fellow employers from your area would also check that box. Really joining costs you nothing but a little of your time, and in exchange you'd be given the opportunity to influence the outcomes of legislation that impacts your employees and their families.
Excellent. So a way to become educated about the issues that are at hand. You're staying on top of state legislation that is in process or potentially pending. Make your membership aware of that, and then give them some specific direction as to things that they can do to affect those pieces of legislation that are out there. Am I understanding that right?
Exactly.
Excellent. Yeah. So
Can I just add something?
Oh, please, Josh. Yes.
Can I add something to that point? So I just for the audience, understand in these hearings, when a lot of these bills are heard, there are patient advocacy groups that come in and look, they've got stories to tell, and they're heart-wrenching stories. I mean, people need healthcare. Employers aren't trying to take healthcare away. I mean, employers are trying to make it cost-effective. They want to be able to incentivize people to use the right providers and the right channel, and promote generics and different things to make it sustainable for everyone. In a lot of these situations, I remember I served on the governor's task force for prescription drug reform a few years ago, and an individual came in that was diabetic and was telling the story of insulin and couldn't afford his insulin, and going through all this stuff, and we figured out in the end he was not covered by an employer-sponsored plan. He was unemployed at the time. At that point, let's not propose reforming plan designs and making employers pay a certain amount and cover things at no cost, and when that wasn't going to fix this person's problem anyway. But those are the stories that come up, and then we make decisions from a public policy standpoint if the employer voice isn't heard that impact the employer on a story that doesn't even relate. So that is, again, the importance of employers getting involved so that this is not a one-sided kind of argument, if you will.
Yeah, interesting point, Josh, right? Because at times legislators are hearing from their constituents and wanting to be responsive to those constituents. And it's important that you listen to, I guess, three sides of the story, if you will, to make sure that you're comprehensively understanding what's at stake. Thank you. Great advice. Rachel, similarly, are there other things that employers can do to come together and make sure that their voices are heard in a single voice relative to some of the things going on at WMC or elsewhere?
Yeah, WMC has taken a much bigger role in healthcare than they ever have in the past, to be quite honest. The last couple of years, we've really stepped up our voice on this issue. And that's because our employers have told us that this is a #1 issue for them. We just put out, actually, it's going to go out later this afternoon, our survey results from our CEO survey. And the #1 thing that our employers say that state government can do to help their business And the number one thing that state legislators can do to help the business climate is to reduce the cost of healthcare in Wisconsin. So this is a huge, huge issue for employers. And we're seeing not only WMC, but other business groups, other business trade associations really step up and come to the plate and be willing to testify, to talk to legislators, join this coalition work that we're working on. And that is really helpful because not every, I would say every legislator probably has a WMC business in it, but they're not always the closest with that business. They might be closest with the concrete business, and they're part of the concrete association. And so having those other businesses involved and working on these issues really makes our voice much more strong and really brings us together with the legislators. But we've seen a huge increase in business associations, businesses themselves stepping up and working and talking to legislators.
Yeah, interesting. And so it is interesting to me that, you know, some of the other economic factors that we're facing relative to, you know, the job shortages or labor shortage rather, you know, low unemployment rates, we really need to find ways to keep our workforce healthy and on the job. And so more than ever, employers really need to be paying attention to things that would encourage that and make sure that, you know, the folks involved with their benefit plan design and their advisors are supporting those same types of initiatives. So I appreciate that work that's being done at WMC and of course at the Alliance and at advancing free market healthcare. Wonderful. Well, that wraps up our you know, my prepared comments. And so to this point now, what I'd like to do is to open it up to discussion with the audience. So feel free to get us questions, those of you that are in the audience, and can ask us some questions. I do have some questions that we received in advance. So we'll go ahead and start with that. Rachel, this one's for you. We keep hearing about redistricting at the state level. What is it, and how might it impact us after the elections this year?
So redistricting has been kind of a elongated process this session because typically every 10 years a census is done and legislative districts are redrawn based on those census results. There was districts put into place, then the majority on the Wisconsin Supreme Court switched, and so they threw out those districts that were in place and said that there needed to be new districts drawn. The legislature submitted maps, the governor submitted maps, and some outside groups submitted maps to the Supreme Court. Supreme Court decided to only look at 4 of those maps. The legislators' maps were not a part of those that were being considered by the court. In that process, the Republican majorities in both the Assembly and in the Senate decided that the least bad option for them that was in front of the Supreme Court was the governor's proposal. Now, I'll be honest, it was not a favorable map to them, but it was probably the least bad option. So they decided to pass that. And when they did pass it, the governor did sign it into law. So currently, Republicans have a 64-35 seat majority in the Assembly. And in the Senate, they have a 22-11 seat majority, meaning that they have a supermajority that they can pass vetoes or they can override vetoes that the governor signs. That will change significantly after this election because of the new maps that are in place. If you purely look at the numbers, and those numbers from the last gubernatorial race and the last presidential race, and a composite score between those two races, the Democrats would take a 51-seat majority in the Assembly. And in the next election, the Democrats would take an 18-seat majority in the Senate. Now, why I mentioned next election for the Senate is because every 2 years, half of the Senate is up for election. This election, even number districts are up, and next election, odd number districts are up. This election, there's no way for Democrats to take a majority in the Senate. I think there's 3 competitive seats, and if I had to make a prediction, I think Republicans probably will hold 2 of those, which would give them a 20-seat majority. In the Assembly, there's actually about 11 seats that are toss-up seats that people are looking at. 10 of those 11 are Republican-held seats currently, and one of those is a Democrat seat currently. Of those, I think it's really 50-50 who's going to win what seats, and within those 11 seats, I think if I had to make a prediction today, Republicans would probably take a 52 or 53 seat based off of some of the things I've seen out there. But it's really a toss-up, honestly. And so I expect Republicans to come back with majority in both houses, but it will be a much narrower majority than what they currently have. I will also mention that a couple of the people that are within the Assembly caucus are some of those kind of similar to what I mentioned at the federal level, are kind of some of those outsider folks. In fact, one of them probably will not even caucus with the Republicans. And so it will be a very difficult majority that they will have to navigate. They will probably have 2 to 3 to maybe 4 of their members that are willing to break off from them at any time. And that means that little probably will get done. The biggest thing that the legislature works on every year is the budget. And I think that typically takes a few months. But I think that it's actually going to probably take a little bit longer than what it has in the past, because I think there's going to be a lot more negotiation. There's going to be some distrust between the legislature and between the governor based off of some of the vetoes that the governor did in the last budget cycle. So I think that that's going to eat up a lot of time. And I think a lot of other things are going to have to be pushed to the sidelines unless they're bipartisan things that really have authors that are willing to push hard to get them implemented. If you have a legislator that's only kind of iffy on their bill, or they're just doing it because someone asked them to, their bill is probably not going to get across the finish line. You really have to have the passionate legislators working on your bills in order to get them finished this session.
Yeah, interesting perspective, and letting us understand a little bit about how decision making might be made behind the scenes, and again, interesting to understand that perhaps even at the state level that we're going to need a little more bipartisan support for these things in order to move forward. Change in perspective that way. Thanks for that summary, Rachel. Josh, looking to you with regards to opportunities upcoming for private employers to take advantage of the prescription copay limits, those caps that we've heard about on insulin, for example, on Medicare. Are there ways that commercial programs might be able to take advantage of that?
Yeah, not specifically, but on that issue, I do want to point out that the reforms that resulted in some of that stuff happening with insulin, federal reforms, are benefiting employers right now. So, the 3 insulin manufacturers that kind of dominate the market all announced pricing changes for January 1. That was a direct result of federal legislation, which actually they would have had to give all of us insulin for free if they didn't change some of their pricing. And it just has to do with how much they've increased the price, and it has to do with rebate dynamics. And, that's a whole nother topic. But because of that pricing change, employers are experiencing a much lower price on insulin January 1 than they were in the past. So in the past, if they were getting the rebates from insulin, they had to wait quite a while to get them. Some plans weren't even getting them. It depends on their PBM contract, and somebody else might have been keeping them. But now they are benefiting from that. Is it going to go any further than that? Probably not. If you want to expand on it and go into the Inflation Reduction Act and negotiations of certain pharmaceuticals for Medicare and Medicaid, I don't see employers being hurt or immediately benefiting from that dynamic. I do think over time, the forced negotiation is forced information. PBMs will be able to get that information. They'll be able to use it to leverage price for commercial plans. But we're talking a 27, 28 dynamic. The first round of pricing changes don't go into effect until 2026. So I think there's going to be quite a bit of time before there's any impact seen by employers.
Interesting. So, and staying on this topic, Josh, I got a follow-up question from a listener that is related to the influence that these Medicare prices might have on us as commercial payers. So the question is, will the impact on Medicare negotiating drug prices potentially allow commercial cost shifting to take place?
Yeah, and I know that's the fear, well-founded, because we see that on the medical side that Medicare pays a much lower price and the commercial market basically supplements. I'm usually a realist, but here I am cautiously optimistic that it's just going to give PBMs more information. Look, when CMS came out with, this saves $6 billion, 10 drugs, forced negotiation, we're going to save all this money. Understand that 5 of these 10 drugs, we're already going to see competition by 2026, either generic entries into the market or biosimilar entries into the market that will compete against these drugs. And those are all known to lower price. So some of this was already going to happen. Commercial plans are going to benefit from that the private market was going to take care of that anyway. Are we going to get more benefit or is it going to cost us? I don't think it's going to cost us, but maybe I'm naive. I just think the market's going to change so much by the time that those pricing changes go into effect. I don't think there's going to be huge negative impact to employers.
Yeah, interesting perspective, Josh, and then also understanding that there's multiple variables at play here, so there really isn't just a single cause and effect situation happening. So thank you for your insight.
Sure.
Last question that we'll have time for as we wrap things up here this morning. Melissa, if you could start on this, and I'll invite Josh and Rachel to add to it. I think this is an interesting question from a listener. What do I need to do to protect my company? Pretty straightforward. Melissa, how would you
that's a great question. Well, we've said it a couple times today. The most important thing is to stay informed. Second, there's power in numbers. So I would encourage people to put yourselves in situations where you can learn from other employers. Obviously, we have a lot going on. All of the panelists here today are working collaboratively together. We're supporting the mission of advancing pre-market healthcare, which is really the grassroots piece of the work that we're doing. And then finally, I'd say make sure you're working with benefit partners who are knowledgeable, transparent, trustworthy. This isn't a nice to have. It's now a legal imperative given employers' fiduciary responsibilities.
Rachel, anything to add?
I think that's a great summary. The only thing I would add is just stay in touch with your legislators. They're normal people. They're just like you and I. I think sometimes there's this impression that they're hard to talk to. They're difficult people. No, they're everyday, humans. And so just reach out to them and stay in touch with them and get to know them. And I think also invite them to your facility. I think all of them love doing tours. And so dangle a tour out there and then talk to them about healthcare as well.
Great advice. Josh, wrap us up from a PBM perspective, pharmacy perspective. What do I need to do to protect my company?
Yeah, the first thing I would just reiterate Melissa's point on engage. Contact us if something comes up and you want to know, wow, this sounds really good, whatever they're proposing, but I have some questions. Is there more to know? A lot of times there is. So contact us. We'd be happy to talk to you about any of these issues, give you the other side of it, or we might say, no, it's a great piece of legislation and we think it'd be really good for you as an employer. The other thing, and again, this is kind of adding on to what Melissa said, these fiduciary lawsuits that have come into the PBM world, it's no longer okay to just, get a broker consultant that analyzed something and said, you should go here. You need to be documenting that stuff. You need to be documenting why you made certain decisions on a vendor. You don't have to go lowest cost, but you have to, document why, what analysis was done. So get that information that maybe you haven't gotten in the past and file it away just in case you would be one of the employers that would be targeted for one of these lawsuits.
Yeah, great advice for those of us that haven't been keeping copious notes and making those remarks known in a file, that might be the thing that we want to be doing going forward. Thank you for that. Wonderful. Well, with that, I want to thank you all for participating in today's webinar. Our panelists certainly got a wealth of knowledge on their individual topics. Appreciate them participating. And thank you all for listening. I hope that you found this useful and that you can take action on some of the things that are out there and available to you. Know that we are here to help, so please use that QR code on the screen right now to get in touch with us, and we'd be happy to hear from you so that we can make it easier for you to take action and becoming educated and letting your voice be heard. We're looking forward to that. And again, groups that are out there that you can get involved with, including Advancing Free Market Healthcare. There's a QR code, and if that is helpful to you to get involved there. And then where you can find us coming up here in the near future, right? You'll see us on October the 8th, navigating healthcare for your business at the Radisson Hotel in Rockford. We'll also be at the Wisconsin State SHRM Conference in the Dells at Kalahari Resort. And finally, on October the 17th, WMC Business Day. Rachel, is there more that you can tell us about WMC Business Day?
Yeah, happy to pitch this event. It's a great event. It's a good networking event. October 17th. It's the largest gathering of business representatives in the state, and it's something that we really love doing. There is a networking reception the night before on October 16th that you are welcome to attend as well. But on the 17th, there will be some great presentations talking about leadership, talking about geopolitics and kind of what's going on in the world. And then there'll be I think this will be particularly interesting, an election preview. And the two panelists are going to be the former DNC chair, Donna Brazil, and the former RNC chair, Reince Priebus. I think they get along really well, and I think it'll be actually a really fun presentation. So we would love to have you come. The coolest thing, Made in Wisconsin, a competition that's going on right now, the winner of that competition will be announced that afternoon as well. And it's always fun to see the different products that made it into the top 4. So you're welcome to go and join us at that event. We'd love to have you.
Excellent, Rachel. Thank you for that. A great way to get educated and connect with your peers. So with that, we will wrap up today's discussion. I want to thank you all again for joining us. And until we speak again, let's keep the conversation going.